There we go.
Hello, I'm Jennifer. I'm a student with Cumberland University. And you are?
I'm Kyle.
I'm going to do your health physical assessment today. And I'm going to go ahead and shut the door for privacy and wash my hands.
Okay.
And can you go ahead and tell me what your date of birth is?
8/8/88.
And what's today's date?
4/26/14.
Good. I went ahead and reviewed your relevant medical history before I came in, your medications and your allergies, and everything looks good. Your vital signs are within normal limits. I see that your blood pressure was 120/82, your pulse was 86, your respiratory rate was 18, your temperature is actually 98.2. All of that is really good and looks good. Let's see. I can see that for this season, you're dressed appropriate and your appearance is neat and well-groomed. So I'm going to go ahead and start your assessment. At any point during the assessment that you feel uncomfortable or want me to stop or you have any questions, just feel free to let me know. Okay? Do you have any problems right now with that?
Nope.
No? Okay. So we're going to go ahead and start the exam.
Okay.
Alright? So the first part of it is I'm going to assess your head and your scalp, so I'm going to have to put my hands on you to do that. Alright. And I'm just checking for some lumps, bumps. I don't feel anything through here, all the way up through the back, and nothing. Okay, now I'm going to go all the way down to the neck, and it's symmetrical down to the shoulders. No lumps, no bumps or anything, no nodules. Check the outside of the ear. Tracheus is normal. That looks good all the way in. I'm going to check your frontal sinuses. Any of that hurt?
Not
Either
today.
one? Okay, good. Alright, and then I'm going to check with the light. And we're going to start by looking at your eyes. I'm just going to shine the light in them for reaction. That looks good. Then we'll look in each ear. No redness or drainage in that one. No redness or drainage in that one. Now we'll look at your nose. See? No redness or drainage. Now we're going to go into your mouth and open up, and I'm going to look at the back. Your uvula is center, and it's good. Say ah. And the patient is able to say ah appropriately. Speech is correct. I'm going to look at the upper palate and the lower. Lift your tongue up for me. Okay, that looks good. Go ahead and stick your tongue out. Move it side to side. That's appropriate. Now move your eyebrows up and down. Okay, and smile. Alright, that's just testing the cranial nerve. That all looks good. Now, I'm going to go ahead and look at your hands. And just look in your skin. And your pupils look good. Capillary refills less than 3 seconds. That's appropriate. And then I'm going to go ahead and look for my equipment at this time. I've already got everything together, as well as the stuff that's on the wall. I'm going to listen to this after we do some tests with your eyes. And what it does is also it does the rest of your cranial nerves, okay?
Okay.
So what we're going to do is go ahead and follow my finger. And we're going to do what is the H, okay?
Okay.
Don't move your head, just move your eyes. So we're going to go up, and out, back in, up, out, and down. Okay, that's appropriate. Now, cover your left eye with your hand. Alright, and we're going to do a peripheral test, so when you see my finger, you let me know, okay?
That's it.
Alright, now go ahead and cover your right eye. We're going to do the left.
See it.
Okay, so that's appropriate, and it seems well. And now we're going to go ahead and have you sit on the side of the bed for me. I'm going to look at your lung sounds in the back. Deep breath. Again. One more time. Again. Your lung sounds are clear in the back. Okay, now I'm going to check for primitus in the back, so I'm going to go down through here and you're going to say 99.
99. 99. 99.
Okay, and now I'm going to check for chest expansion, so you just need to take a deep breath. Okay, one more time. Regular rate rhythm, you're symmetrical and good chest rise, and that seems good, good expansion. Okay, now I'm going to come around to the front and do the front assessment. Listen to your blood sounds, deep breath. Again. 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 Your lung sounds are clear in the front also, and good expansion and regular rate. I'm going to listen to your heart while we're listening. Just relax. Now we'll listen to your apical pulse at the 5th intercostal space. That's good. That's regular rate and rhythm with no murmurs noted. So, and then I'm going to listen to your abdomen. You can go ahead and lay that down for a second. I'm going to listen to your aorta. No bruits noted. I'm going to listen to your stomach. All 4 quads are equal. Bowel sounds are good. I'm going to look at it. Everything looks good. You're okay with me lifting this up and looking at the rest? Okay. Alright. Now on his abdomen there's no scarring and no abnormalities, no lumps or bumps, nodules noted. So now I'm going to go ahead and feel. I have to do light and deep to assess for your spleen, kidneys, and liver. And I've already checked the aorta, and I'll check that one more time as we go through. Any of that hurt as we go through? That was the light. Now we have to do it deep. Any of that? Okay, no pain. That's good. So that your normal limit. One more time, I need to check your carotid up here for any bruits. Nothing noted in there. No bruits. Okay, so now we're going to work our way down to the lower extremities and check your pulses. Have you had any edema? Any pain? No. Okay, so I'm just going to feel your legs as we go down. No edema noted. Now I'm going to check repeated pulses and posterior tibial pulses. Those are all equal, bilateral, and regular rhythm noted. Now we're going to go ahead and have you stand up, and I'm going to check your mobility and range of motion, okay? Yes. So what I'm going to have you do is you're going to walk towards the door, and then I want you to turn and walk back towards me.
Okay.
Okay. All right. And turn around. That was a regular steady gait. I noticed you didn't have to use any assistive devices, and you didn't have any pain while you were walking? No. Okay. That's good. No unsteadiness. So while I do this, I'm going to have you bend over. I'm going to check your range of motion, also check your spine for any scoliosis, okay? Or any abnormalities as I check down through here. That's all symmetrical. And no scoliosis noted, so you can stand back up. Okay. Alright. Now we're going to do the eye coordination part. So what, I'm going to stand in front of you while you're standing here, and I want you to do the coordination test where you take your index finger and touch your nose with your eyes closed. And we're going to start with the right hand.
Okay.
And go ahead and touch your nose. Alright. Now do your left, straight out and then in. There you go. Okay, that's good. Now we're going to do the other part where it's coordination. You're going to take your side of your foot and touch your shin.
Okay.
Opposite leg. There you go. Okay, and then we'll do it again. Alright, that's really good. Now go ahead and have a seat. We've got one more test we're going to do. Actually, no, just sit like this. Yes. I'm going to do a whisper test, and what I am going to do is repeat, or say a number, and you're going to repeat it to me. Okay?
33. 55.
Okay, that sounds good. And then now we're going to do what's called the skin test, and what we're going to do is go ahead and touch your skin. And I'm going to do it in different areas, and I'm going to do it with a soft, and then I'm also going to do it with a firm, and you're going to tell me when you feel it, okay?
Okay.
So go ahead and close your eyes.
Okay. Feel it. Feel it. I feel it. Feel it. Right. Right on. cheek, left cheek, right cheek, left arm, left hand, right leg, right foot, left foot, left leg.
Okay, so that's good. You got all those markers correct. That actually concludes our examination today, and we're actually going to go into the other room and discuss our findings, any abnormalities, and then I'll let you know where we'll go from there.
Okay.
Okay, thank you.